So let's talk about some more presentation tips. So first of all, spell checking your slides is a really important step when you're preparing your presentation. So unfortunately, in English especially, spelling errors on your slide may diminish your credibility and convey to the audience that you're not well prepared or that you don't care a lot about your presentation. So we know that that's not the case, but spelling errors may convey that to your audience. And so make sure this is a simple correction. So just use a spell check. So make sure however you're doing your slides, whether that's on PowerPoint or some other software, make sure you use a spell check. Just set the language to English, and that should help catch errors. So sometimes there may be medical words that it may mark as incorrect that are actually correct, but it can you can at least find the majority of words that are spelled incorrectly and check them. Okay, another way that you can make sure that there's no errors on your slide is the second tip, which is sharing your slides with a colleague and asking for feedback. Okay, so this is another great way not to just improve your spelling, of course, but to improve your presentation as a whole. And so if you share your slides with a colleague, they may give you feedback like, I didn't understand this part, or I didn't understand this abbreviation, or maybe it'll be helpful to add the normal range for a certain lab finding or for vital signs for a child, for example. So they may give you some really helpful feedback that you can then use as you're working on your presentation. So we would really encourage you even to share your slides with someone in this class. Share your slides and ask for feedback, and perhaps y'all could do a switch, sharing your slides with each other and helping each other to improve. Okay, also, our team here in Advance in Medicine would be happy to review your slides and to give you feedback. Okay, it is hard. Sometimes we have students that send us their slides the day of the presentation or the day before and ask for feedback. At that point, it's hard for us to really give good feedback because it's right before the presentation. So if you want us to review, we're happy to review your slides. Please send your slides at least a week prior to your presentation. So ideally by the time of your live session for Unit 9, please send your copy of your slides. They don't have to be completely finished, but send us your slides and we can give you some feedback. So also, last tip, for this presentation, there's going to be a short question and answer session at the end. So this is common medical conferences here. I know you do this as well, but often doctors will answer questions about their case after the presentation. So this will give you the opportunity to practice speaking spontaneously as people ask you questions and you have to respond on the spot. We just wanted to make sure that you know that this is happening, is kind of the tip for the reason we're bringing it up here. And then in Unit 10, we're going to give you some other tips for how to respond to difficult questions, or if you're not sure about the answer, what you could say. We're also going to be talking in Unit 10 about how to ask questions so that you feel prepared in asking questions to your colleagues during their presentations. So just want to let you know that that is happening. Again, in Unit 10, you're going to find some more tips related to both asking and responding during the Q&A. But just be thinking about that as you are preparing your presentation.